Okay, today I will be taking care of Miss Sandra Jones, and I received an order from her provider. I'm looking at my MAR, and right now I determine that Miss Sandra Jones has 150 ml normal saline running per hour with 20 milliequivalent potassium chloride, and my provider's order is morphine sulfate 2 milligrams every 4 hours for pain. Actually, that's PRN. Before getting my medication ready, I want to make sure that that morphine is compatible with the one running right now with my patient, which is the normal saline with potassium chloride. So what I want to do is pull up my Skyscape. So I'm looking it up. So I found out that morphine is okay. It's compatible with potassium chloride and normal saline, and it says that I could administer it on a white site, which is what my patient has, and it says here also on my Skyscape that I should be administering it within 2 to 5 minutes. So it's kind of a little slow infusion. So after determining that, I will do my dimensional analysis to compute my dosage, and I determined that my vial has 2 milligrams per ml, my morphine sulfate. So I determined that I will be needing 1 ml for my patient for her pain. So I got my 10 ml sodium chloride for that to mix with. I also got 3 ml to flush. And now I will be preparing my medication for my patient. So I would wash my hands, and I would want to clean my vial first. Cleaning my vial, and with that, since I am drawing up, just get all my stuff ready. So I want to make sure I got trash next to me, and I will be, after I check all my supplies, if it's not expired, if it's not tampered, so it means I'm good to go. So I have 1 ml. So what I want to do is drop air, 1 ml. Okay, and now I will be putting 1 ml air right there. So here, making sure there's no bubbles. Just use some pen, make sure there's no bubbles. Okay, if I see that there's no more bubbles, I'll be getting my sodium. I'm at the med room right now, so it's just me. And you just make sure to prime it. Okay, there's no more air, and now we'll be just injecting this one. Okay, make sure there's no air. Put it in my sharps container. Over my medication here. Okay, looks good. If I see more bubbles, I just want to make sure there's no bubbles, and I want to make sure that I don't spill any medication, because morphine is pretty precious medication, so I want to make sure there's no spilling, and I want to make sure I get all that 1 ml in my normal saline. So after doing that, I wanted to label my morphine. So date, time, and my initials. So I'm labeling that. Just put it right here. Okay, and now I am going to my patient's room. So I'm gonna bring my vial with me, make sure I chart that, and some gauze pad. I'll call that pad. So I'm going to my patient's room now. Knock, knock, knock. Hi, Miss Sandra Jones. My name is Bianca and I'll be your nurse today. How are you? Fine. Okay. Are you having any pain? So my patient told me that she's in pain right now. She's at 9 and she said she wants some pain meds. So I got, okay. Miss Sandra Jones, I got some medication for you for your pain. And I see, I'm checking on my, actually before doing that, I should have checked on my patient's identification first. So Miss Jones, can you tell me your full name and date of birth? So I determine that, and I determine her allergies. So if I have a scanner, I will be scanning her name and looking at the MAR. If it's the same, it matches. And I am again double checking what my MAR, and I'm scanning it again, my medication. So I want to make sure it's all compatible and it all matches. So what I want to do is I want to assess first. I want to wash my hands. I want to assess first Miss Sandra Jones' IV site if there's any infiltration or any signs of phlebitis. So I'm checking. It looks good. There's no signs of infection. Anything looks normal to me. So I will be explaining to Miss Jones the medication that she'll be getting, and that she'll be getting some morphine, and it's for pain. Now what I want to do is stop the primary bag, and again I'm going to wash my hands, and I will be injecting the morphine now to my patient. So before doing that, I want to make sure it's not clamped. So it's not clamped, this is stopped. Alright, Miss Jones, I will be giving you some pain medication. So I'm cleaning the port for at least 15 seconds. There. Make sure I hold it. I'm just gonna. Okay. So I'm gonna inject the morphine sulfate to my patient. So I'll be infusing it at least around 2 to 5 minutes slowly. So I wanna document the time that I started. So I'll be documenting on my paper. So let's say it's 2 o'clock right now. So I'm slowly injecting it. And let's say after 5 minutes, I'll be also documenting the time that I stop. So after infusing that, I will be flushing with 3 ml normal saline. So I'll flush that. And the purpose of flushing is to make sure that the medication goes all the way into my patient's vein, because some will maybe stuck here. So flushing looks good. So after flushing, make sure it's okay. Alright, so discard all the things that I've used, and I am continuously assessing my patient's skin, the site, and after doing that, I'll document and start the primary bag again.